Now the next part in the risk management process is the risk management review. So here we have to perform an activity where whatever risk we have identified, what was the severity, what was the actions taken, and what is the completeness of risk control, that all activity we have to present as a risk management review. So this risk management review has three parts. First is the review of control measures or completeness of risk control. Second is the evaluation of overall residual risk, and third is the preparing a risk management report. So to start with completeness of risk control, before reporting any results from the examination addressed in the risk management plan, the laboratory must carry a comprehensive review of the entire risk management process. So it is the responsibility of the laboratory to carry a review of the risk management process, whatever exercise the laboratory has done for mitigation of the risk or for the control of the risk with respect to the risk assessment, risk analysis and risk management. This complete process must be reviewed by the laboratory. The responsibility of review should be assigned in the risk management plan. What are the important things that must be included in the risk management review? So first is the risk management plan, whether it has been appropriately implemented or not. Second thing is the risk from all the identified potential hazardous situations, where all of them have been considered or not. Third is the whether the residual risk is acceptable or not. And fourth is the appropriate methods whether are in place to obtain information necessary to monitor the risk. So there must be appropriate methods or measures to obtain necessary information with respect to the monitoring of the risk. So these are all things which should be included in the risk management review plan or risk management review process. Now the second part here is the evaluation of overall residual risk. Now once the risk measurement or risk control measures are in place, they are implemented and verified, the laboratory must consider the combined impact of the individual residual risk and decide whether the overall residual risk for each examination or service is acceptable as per the laboratory's risk acceptability criteria, which the laboratory has already defined in the risk management plan, which we have seen at the very beginning. So the residual risk of the individual process to be combined with the residual risk of the overall process, and that has to be compared with the risk acceptability plan, risk acceptability criteria, which we have mentioned in the risk management plan. If the overall residual risk is not acceptable using the criteria established in the risk management plan, again the laboratory may conduct a risk benefit analysis. So what is risk benefit analysis? We have seen already. The evaluation of residual risk is an important step, particularly for complex examination procedure or laboratory services where large number of risks can be involved. Since the procedure is a complex, in each and every process there can be a risk and a residual risk. So the complete review of residual risk is very important for all of this procedure. This evaluation can be used to determine whether the examination procedure or laboratory service is safe or not. The overall residual risk has to be based on clinical judgment exclusively, and the documentation of this residual risk is important in the risk management file. Now the last aspect of this risk management review is the preparing a report, a complete risk management report. So the result of this comprehensive risk management review must be recorded in a risk management report. And what must be included, or what are the basic summaries that must be included in the risk management plan? Here I have mentioned. First is the risk management plan, whether it has been satisfactorily fulfilled or not. Results confirm that the residual risk is acceptable or not. And finally, the risk management report shall be approved by the laboratory management. So these are the three important part of risk management report. Now we have discussed one aspect is with respect to the disclosure of residual risk. So what is this disclosure of residual risk? Because this needs to be a important part of your risk management report. When deciding how to disclose the residual risk, it is important to identify what is to be communicated or what are the things needs to be communicated to the intended users, to whom it should be addressed, to motivate and enable users to follow the examination procedures and use of equipment safety, to inform clinicians of any limitations that could affect the patient safety. We have to inform the limitations of each of the procedure which is followed in the laboratory so that the patient safety should not be hampered. So in that case, the laboratory should consider the level or detail which are needed to be disclosed in the residual risk. The wording to be used ensure clarity and understandability. So the whatever wordings we are using for the disclosure of residual risk, it should be very clear and must be understood by the people who are the intended users. The laboratory also must consider the intended recipients, whether they are equipment handlers, whether they are service personnel, clinicians, patients, or any other stakeholder of the laboratory services. And lastly, the mean or the media which we are going to use for this communication. It can be your written report, it can be some form of email communication, it can be some form of declaration. So we have to consider the mean or media which we are going to use for the disclosure of the residual risk. Disclosure of the residual risk must be a part of risk management review and it must be appropriately declared to the intended users. So with this we are going to complete this risk management review, how to perform the risk management review and what are the components of risk management